Hello everyone, good evening. I'm Steve from UCAN English Tutoring. In this video, I'm going to assess one of the students' OET letter and provide feedback on each assessment criteria plus the overall score after that. Okay, you have written on the addressee's contact details on the top, which is good. I'm happy with that. And then you have written on the date as well. So there is no issue here. And let's move forward. Okay, so you have written on Dear Miss Roberts. So you have used the correct spelling. So the salutation is good. I'm happy with that. And then regarding Mrs. Thompson, comma DOB. Okay, try not to write down DOB. It is always important to express the full words of those abbreviations. Okay, so you need to write down date of birth. Okay, sorry.
Okay.
Date of birth. All right, it's always recommended to expand the abbreviations. I'm writing in regard to. It's not in regard to, but it is in regards to. All right, in regard to is
Nice.
incorrect. Yes, in regards to. Otherwise, you can say regarding. Okay,
Okay,
regarding.
sir.
All right. Who was diagnosed with the right shoulder osteoarthritis? Okay, that's all right. Currently, she is set to be discharged and requires assistance and appropriate care from your facility. Yeah, everything else is all right. Except this, everything else is okay. I'm happy with that.
Okay.
Yep.
Sir, we can write, I'm writing in regarding to, or I'm
No,
writing in
regarding to, no, to needs to be removed when you write down regarding. You have to say,
regarding.
I'm writing regarding Mrs. Thompson. That's it.
Okay.
All right. Okay. Mrs. Thompson was admitted to our hospital and underwent right total shoulder replacement. Okay, that's all right. But is it A? I think there is
Yes,
a
sir.
spelling mistake. Is that A, C?
Acement.
Okay, you have to write down the words clearly. Okay, your
Okay.
handwriting isn't that good. Okay, all right. We underwent for the above mentioned diagnosis. Okay, that's all right. Post operatively, there's a mistake. Okay, post operatively cannot go together. Although it is one word only, you should have split it using an hyphen in between. It's actually post operatively, comma. Okay, post and then
Sir.
hyphen and then operatively. That's the correct way of writing down. All right, the way you have written down is incorrect. Okay, there is no hyphen in between. All right, post operatively, her right shoulder x-ray was performed. No, her x-ray, her right shoulder x-ray. That's all right. Again,
Yes, sir.
x-ray. Did you mention any hyphen in between?
X-ray hyphen is there.
Okay, but I can't see that. You have written on close to X. Okay, x-ray was performed. Okay, is that PER?
PER.
See, this E, it doesn't sound like E. I mean, both
PE.
R,
Yeah,
E, and
it
R
looks
look
PE.
same. It's not good. So this E
Okay,
is
sir.
okay to some extent. Okay, the one after M is okay to some extent. You have to clearly write it down. Okay, the examiner may not
Okay.
have patience to go through this and then think about them or zoom in and then see that. No, it's not the case. They
Okay,
don't
sir.
have any equipment to zoom in and then see, oh yeah, it's like microscope or something. They can't use that. Your handwriting must be clear, okay, and neat. All right, it
Okay.
doesn't need to be beautiful, but it needs to be readable. All right. Okay,
Okay.
x-ray was performed to confirm the position. Is it the position? What is this?
The
You have written,
position.
yeah, okay, the position of what is the TSR? You have to expand that. It's not good. TSR needs to be expanded. So expand the abbreviation, please. Remember that all the abbreviations need to be expanded. Okay, it doesn't matter whatever it is. Okay, her pain was managed with analgesia and cold compress. That's good. The patient's, what is this? The patient's neurovascular assessment was done. Okay, the patient's, this is wrong. Okay, why? I'll tell you. The patient's, okay, this is wrong. You should use an apostrophe. Okay, after.
Apostrophe is there, sir.
Oh, is
Is
it
there.
there?
Yes, yes, sir.
But it's not visible. I don't know why I can't see that. Is it, where is that apostrophe? But you have written on after S.
Apostrophe is up.
After S?
No, no, before S.
Oh, is this apostrophe? Okay. Oh my God. You shouldn't. This is really long, isn't it? This is a long line. Like just use a small apostrophe. Okay, don't use this. I thought that
Okay,
it
sir.
is it's belonged to maybe a comma for the previous sentence. Okay. All right. Okay, the patient's okay. If that's the case, I'll remove that. Yeah, assessment was done. Okay. Currently, she requires assistance in her activities of daily living. Okay. Assistance in her. Okay, so this can be removed. Sorry. Assistance in her. Okay. Assistance with her. You need to use the prepositions appropriately. With is more appropriate than in. Assistance with her daily activities of daily living. All right. She performs exercises as per the
Yes,
TSR protocol. Okay, again you need to expand that. So what is this?
expand that.
Is it the current situation? Is she performing this, or is that the case with the
Performing.
past? So she
Like
is performing.
currently she's performing the
Okay, that's all
exercises
right. That's
as
all
per
right.
the
And
TSR.
then okay, that's all right then. TSR again. You need to expand that. It's not good. All right, let's go to the next one. Okay. What is this? She okay, that's fine. Okay, her wound is clean and dry. Her wound is clean and dry. That's okay. That's good. Mrs. Thompson is a widowed woman. You don't need to say widowed woman.
She's a widow.
She's a widow. Yeah, that's it. Why you are adding words that doesn't make any meaning at all? It doesn't add any value. We shouldn't unnecessarily add words. Okay, do you understand? A widow. She is a
Uh,
widow. That's it. Widow itself means a woman who lost her husband. Okay. All right. Okay. And lives in a single story house. That's good. She has a medical history of chronic, what is a chronic right shoulder
right,
pain,
pain
which, what is this? Which resulted
resulted in
in decreased movement and ability to carry out activities of daily living. Okay, that's all right. I'm happy with that. Okay. Did you write this one yourself or not?
no, no.
Okay, that's wrong. Okay. Upon discharge, it would be beneficial if you would take over this patient and what is it? Provide, right? And provide
Provide.
appropriate care. Yeah, okay, that's good. Kindly note on 21 July 2017, her staples, is that need or needs?
Need.
Need only, right? Then it's all right. Need to be removed. And again, okay, there is an issue. I'll tell you what are they. On 21st July 2017, look at this one. 17, right? So sorry, 15. So 15 and then 6 days. It's going to be in 6 days.
Seven
You
days
have to
after
say,
7 days.
yes. So 15, 16 means one day after 6 days, actually.
After. Yes, ah,
Yeah,
yes, sir.
after 6 days. So you should mention, instead of writing down on July sorry, on 21 July 2017, you can say after 6 days. Okay.
After 6 days.
Yeah. All right, that's one thing. And then the other is a staple. Okay, need to be removed. Required to be removed. Otherwise, you can use a different phrase. Okay, for example, you can say kindly note removal of her staples is scheduled in 6 days. Do you know what I mean?
6 days. Yes,
Yeah,
sir.
so you can use the passive voice. This is an active voice, but you can say using the passive voice, the one that I have told just now. Okay, and a follow-up appointment in the orthopedic joint replacement outpatient department. All right. So this is a specific unit, in that hospital, isn't it? Then you have to use the capital letter. Yes, you're right. They have corrected
Uh,
it, right? Yeah, correctly. Yes. If it is a specific department in a particular hospital, then you have to write it down. But if it is in a general recommendation, then you should not. Okay. Kindly unsure that. Is it unsure? No, it's ensure.
ensure.
But that's
Ensure.
wrong.
Sir, whether
Yes.
we have to write the capital, the
No,
orthopedic department.
not for the. The must be the small letter only. but for the other things, yes. So they have mentioned it
Sir, and
correctly.
when we mentioned like was admitted to one hospital, maybe a St. Andrew's hospital, so we have to
Then
write
yeah,
was
yes,
admitted
capital
to
letters.
the St. Andrew's hospital
No,
or
no,
just St.
admitted
Andrew's
to,
hospital.
yeah, admitted to, the St. Andrew's Hospital. That's fine.
Oh,
You don't need to the over there. All right. Okay. Ensure that the patient doesn't perform any strenuous activities. Okay. Okay. I think there's a spelling mistake with the activities. Okay. Let me see. Kindly ensure that the patient doesn't perform any strenuous activities. Can you please tell me the spelling that you have written on here? Is it
A A A
ACTIVITYES?
C T I V.
Yeah.
I just written activity VITY, but they have done TIES.
But they have done TAEs, right? Yeah,
Yeah, I have written
it's like,
activity.
okay, strenuous activity doesn't mean like there's only one activity, isn't it? Strenuous
Yes,
activities
yes.
means, like the physically demanding things. Okay, so there are lots of things. For example, pulling something, pushing something, lifting something. So there are lots of things, right? So you have to use the plural noun only. So that's correct. So that is okay. Activities. All right, that's fine. Whatever they have done is okay. For 4 weeks, in the case notes, did they use 4 weeks?
Uh, F,
Okay, 4 weeks. Sorry, 4 weeks. You should interpret the information for 1 month. Do you understand what I mean?
1 month. Okay.
Yes.
Yes.
4 weeks means 1 month. For about 1 month, or you can say for 1 month is okay. All right. Is that a full stop here?
Uh, yeah, no, I didn't put, but it's there.
But it's there, but I can't see anything. Okay, so that's not good. So you have to place a full stop. Okay. All right. I request you to make a referral. It's not a referral, make a referral. It's arrange a referral to the community hydrotherapy. To the community hydrotherapy. No. For community hydrotherapy. So this is a treatment, isn't it? It's a kind of treatment. Am I right?
Yes, but in community hydrotherapy is going to help.
Yeah, that's what I'm saying. Yeah, community hydrotherapy is a treatment. It's not a person. It's not an occupation or something. I mean, it's not like hydrotherapist or occupational therapist, isn't it?
Is
So make a referral for community hydrotherapy. That is correct. Okay.
or
And even you can say instead of make, okay, make is not that good. Okay, you can say make a referral. Instead of that, you should have mentioned arrange a referral.
referral
Instead of saying to the, you can say for. Okay,
for
you don't need to say it's just okay. I request you to arrange a referral for community hydrotherapy. That's it.
for
It is important to administer LMWH subcutaneously for 4 days as DVT. Okay, profaxin. Okay, prophaxis, whatever it is. Okay, so again, LMWH need to be
expanded.
LMWH. Yes, expand it, please. All right, and then the next thing is deep vein thrombosis. You have to expand this as well. Try not to write down any abbreviations. It's not good. OSP. Okay, please note, comma, the patient needs okay. It is not needs, okay? You need to use requires. It is always recommended to use formal phrases, not the informal ones. Require
Okay.
a right arm sling. Yeah, you have to use it's not just whenever you need to mention an equipment, okay? All right, for example, right arm sling, you have to use a right arm sling. For example, a pillow, a wheelie walker, a wheelchair, a walking stick, a walking frame. Do you know what I mean? A toilet riser. You have to use either a, an, or the before all the equipment. Okay.
Okay.
Right. For 4 weeks. Okay. You can, again, if they have mentioned 4 weeks in the case notes, try to use it like 1 month. Okay.
And
Yeah, try to you need to interpret. Okay, you can't just write down the same thing. You need to think about their synonyms or interpreting the information. You have to think about that. for 4 weeks, and outpatient physiotherapy. Okay, sorry, for 4 weeks and outpatient physiotherapy. The what is this? Sorry,
The pertinent detail.
the pertinent details. But no, I think this is wrong. This sentence doesn't look grammatically complete or correct. So you said, please
No, I
note,
think the patient needs the right humping forward.
yes, and
I
outpatient
should have written,
physiotherapy.
please note the patient needs the right arm sling
That's
and
correct. Yes.
outpatient physiotherapy
Is there a full
for
stop?
1 month.
Is that a full stop
After
over there?
that, there's a post.
Full stop, but there is no full stop. It's not visible here. Okay, but it must be there anyway. It's okay. And then this is capital the, isn't it? The pertinent details.
The is capital.
Okay, the pertinent details about the patient's medication, okay, have been attached with this letter. That's all right. Contact hospital nurse. So that's what they have
From
included,
Monday to
isn't it? If you
Friday.
require further information, okay, please do not hesitate to contact me. Yours faithfully. And the registered nurse. Okay, he could have used the registered nurse
Okay.
instead of writing down registered nurse. It's better to use the registered nurse. Okay, sorry, must be capital N.
And
Okay.
so one more doubt is like whenever they give a name at like in the starting of the address, they give a name like Miss something, and they give
Yes.
their designation as a nurse,
Yes,
doctor. So you have to
that's
write
right.
the doctor or just doctor.
No, you have to say the doctor. Okay, I mean in the sign off section. Yes. All right. Let's say grammar isn't good. Okay, use of articles, prepositions, nouns, verbs, and punctuation marks could have been better. All right, it's not that good. Okay, spelling is another area of improvement. For example, instead of post and then hyphen operatively, you have said post operatively in one word. Okay, so that's not good. Expansion of all the abbreviations is needed. Okay, expand all the abbreviations. You haven't done that. That's not good. All right, expand all the abbreviations. Use more formal phrases and words. Okay, interpret the dates, months, durations, and so on wherever applicable. It doesn't mean that you have to do it for all of them, but wherever applicable, wherever possible, please try to do that. Okay. What else? Yeah, use of passive voice is highly recommended. Instead of using active voice, please use passive voice. Okay. Connectivity is okay. It's not that bad. Overall task fulfillment is also good. I'm happy with that. All right. Layout is all right. However, your handwriting needs a bit of improvement. Okay. All right. It must be readable. Okay. That's what I noticed. What else? Let's go through that. Needs requires activity need to be a. But I've been able to find out 20 mistakes. I wouldn't have definitely give you, a B grade for this letter, for sure. It may be C plus, maybe, okay, 300 out of 350, but it's not. It doesn't go beyond it. Okay. Again, I need to go through the remaining things as well, like case notes. Okay, just give me 1 moment. Let me go through the case notes to see if you have included all the relevant case notes or not. Okay. All right. Okay. So you're a registered nurse. So who's the addressee? Let's go through the addressee. So the addressee is a home nurse, okay, informing her of the patient's current situation and requesting appropriate care. Okay, address the letter to this in-home nursing service. So she's the home nurse. Okay. You should have mentioned the home nurse as well after, Nita Roberts. Do you know what I mean? Mrs. Nita Roberts, when you have written on the addressee's contact details on the top, you should have mentioned a comma. In the next line, you should have mentioned the home nurse, and then you have to say in-home nursing services. I
You
think
know.
they have given the designation. It's not good. Okay. All right, let's go through this from the beginning. Okay. You got this one. Registered nurse had a right shoulder replacement. Okay, she's to be discharged home today with the assistance from in-home nursing services. That's all right. 73 White Road, Bayview. Does the addressee know the patient already? Is it a known case?
No, it's not a known case.
Okay. Then you should mention the address of the patient as well. Okay, okay. They're gonna be with them. Okay. They're gonna be discharged. Okay, with the assistance from in-home nursing service. So they will get to know their address. Okay, that's all right. 0107. Okay, that's fine. Lives in a single-story house with a large garden. Okay. Okay, let's go through the discharge plan. Do they need any assistance with the home? Okay. All right. Okay, that shouldn't be an issue then. That's okay. Utilizes cleaning services once a month. Okay. Widow, one daughter lives in Bayview, one son married with children, still lives in Stillwater. Daughter will stay with their mother. You should have mentioned this one. Daughter will stay with the mother for 1 month post surgery. This is one of the important case
Okay.
notes because the nurse needs to know if someone would be there to provide care for the patient. Okay, so that's one of the
Oh,
major parameters. Okay, that's one of the major case notes, and you have missed it. Unfortunately, that's not good. Okay, let's go to the next one. Osteoarthritis. What's the current condition? The current one is right shoulder replacement. So whatever the previous medical history that is in relation to shoulder, you have to mention that.
I've written like the pertinent detail.
No. If it is relevant, you have to include it. You have to mention that. Osteoarthritis, right shoulder visitation responded to conservative treatment. Okay, you should have mentioned all these things. Okay, this one, right, humerus fracture in 1997. Is this related to the osteoarthritis or right shoulder? This one,
Right
the
to the
first one.
fracture have happened.
So is that in one way or other? It's not. But
It
this one
was
should
in
have.
1997.
Yeah, you should have mentioned this one. It didn't. Right shoulder didn't respond to the conservative treatment. You should have mentioned this. But this one was already mentioned. Okay, decreased movement. That's fine. But this one should be included. Okay, Voltaren. That's fine. The preoperative. You don't need to include this because it's finished already. Panadin Fort. So it's 8 hourly. Oh, it needs to be mentioned then. This one, the second one. It's ongoing. It's a current medication. The first one, old Terran, has been already completed, so leave that. But the second one needs to be included. Okay, you have missed two important case notes: right shoulder osteoarthritis, right total shoulder replacement. Okay, it was on 11/7/17. Is that the recent date? No, that's not the one. That's when the operation has taken place. All right, that's okay. Post-operative shoulder X-rays, that's fine. So you have mentioned this one, I believe. Yeah, that's all right. Exercise regime compliant with the physiotherapy, post-operative bloods within normal limits for the pain management analgesia. The wound care dry, that's fine. Good. Okay, post-operative exercise regime compliant with the medication, physiotherapy, post-operative. Did you include these things like bloods and exercise regime?
Blood I didn't add because it was in the normal limit.
Okay. And compliant with the physiotherapy. All right. Plan for discharge home with the daughter today. Home nurse to assist at home. Yes, that's Nita Roberts. Do you know what I mean? This one, this nurse, home nurse to assist
Okay.
at home. Yes, that is what the addressee. Okay, the addressee will be there. Okay, observations, TPR, BP, all within normal range. Okay, that's all. Neurovascular, color warmth, that's fine. Oral anesthesia, wound care and observations. Cold compressed shoulder bruise, that's all right. ADL assistance as required, that's good. Physiotherapy management, exercise program, TSR protocol, neck range of exercises, cryo cuff, okay, cold compress, discharge education. You should have mentioned about the discharge education, follow up physiotherapy. Did you include this one? The appointments with the follow up physiotherapy, outpatients, what? Did you mention this one? I'm asking you the question. Hello?
Along with I've mentioned like community hydrotherapy for 4 weeks and physiotherapy,
Physiotherapy.
outpatient physiotherapy I've mentioned.
Okay, all right. What about discharge education? So they have was the patient was educated about the physiotherapy management.
That we have written like the patient would be like not to perform any strenuous
Oh, okay.
activities.
Okay. Yep. No worries. Good. Right arm sling, strictly no lifting for 4 weeks. Did you mention this one? No lifting for 4 weeks.
Yes, not to perform any strenuous activities.
Strenuous activities. Okay. Right. That's right. Physiotherapy outpatients twice a week and hydrotherapy. Did you mention this one?
I didn't mention like 2 weeks or 1 week.
Okay. You have to mention that frequency as well. All right. 10 days post-operative staples removal. You have done that. Follow-up appointment. That's okay. Actually, staples removal will be done in that follow-up appointment.
Yes.
But the way you have written on is something different, I think. All right, let's go through this. Orthopedic joint replacement nurse specialist contactable by calling. You have to mention this one. If there are any concerns, okay, the home nurse needs to call this person, okay?
Uh,
Yeah, but you didn't mention, right? It's not good. So you have missed the three important case notes, three of them, okay? Referral to this one, you have mentioned that already. I'm happy with that. That's fine. That's all right. Okay, staples removal and the other thing. Okay, let me go through that. Staples removal. I believe that staples removal is on a different date. It's not on a different date. I think it should be joint replacement. Okay, where is that? I think it must be the other page. Yeah, staple needs to be removed and a follow-up appointment. No. In a follow-up appointment, do you know what I mean? In a follow-up appointment in 10 days. Yes. So this should be in a follow-up appointment. Okay, in the next appointment,
no
the
follow-up
staples need to be.
appointment.
That's
It's like
correct.
kindly
Don't
note.
say and a follow-up appointment. That's wrong. Do you
Okay,
know what I mean?
follow-up appointment.
Yes. So it must be in a follow-up appointment. Okay. So let's go
Okay.
through that. Okay. You have missed three important case notes. Okay. So it's huge. That's not good. All right. Okay. Let's go through the expected score. Okay, looking at the severity of the mistakes and the problems that you have showed and the number of mistakes and the severity, I believe like this letter may not be able to get even C plus. To me, it sounds like a 290 out of 500 grade letter. That's it. If you have included all the relevant case notes, okay, I would be happy to give you 300, but I'm not happy to give you even C plus. You should know all these things, okay? Anyway, thank you so much for your time. I assume you are happy with my feedback,
Yes,
aren't
sir.
you? Okay, good.